Tennessee Congressman Mark Green, who is also an emergency room physician. Good morning to you.
Thanks for having me on, guys.
You're welcome. What's the political impact here? Because he does have rallies planned. He has fundraisers planned. He's obviously not going to be doing that for the next 10 days unless he does it virtually.
Yeah, I think the biggest impact is going to be on the campaign side. Very clearly, the president can function from the White House quarantined and take care of all of his duties as commander-in-chief. So no one should worry about that. But he will have to, sit quarantined, which will probably be very difficult for our president. He's a go-getter, an action guy. So, but he's got a quarantine, can't do those rallies.
Right, you're a doctor, so what questions do you have? If you picked up the phone and called the White House now, it's the president's 74 years old, his condition's public, we all know that. What questions do you have knowing what you know about the virus?
Well, I think what's really good to hear from them so far is that he's asymptomatic, and the chances are that the vast majority of people are asymptomatic, even those folks that are in the higher age categories. But things like that, just to track his symptoms. We're all praying for him, so we want to know that he's doing well.
Sure, absolutely. As we look at images of the president and Joe Biden were on the same stage just a couple of days ago. And so the question becomes, what's up with Joe Biden? I know his campaign has said that he and Kamala Harris have been tested regularly. Not clear when his last test was. But since Joe Biden was on the same stage with the president, who has now tested positively, and, there were a lot of raised voices, and the CDC says shouting can spread COVID, how concerned should the Biden camp be?
I think they should, it's no greater risk than being around the general population because this is an aerosolized virus. So, they were on the stage. They appeared to be extremely social distanced, kind of hard to tell when you're watching on television. But there is a chance. To answer your question, Steve, Brian, there is a chance.
Okay. Congressman, what role will contact tracing play?
So they're going to use contact tracing to kind of figure out exactly his required quarantine time. So that's the purpose of it. Again, as I said earlier, this president's going to want to get out there on the campaign trail and get going on these rallies as quickly as he can, 30-something days until the election. So that's the purpose of the contact tracing for him. Now, for others, it'll be to say, okay, you were exposed, and they have to kind of get themselves tested at that point.
How does that work? Do they contact anyone who was around him over the last, few weeks?
Yeah, I'm confident that is what they'll do. Of course, they'll find out if those individuals have been in the intermediate, time, been tested. But yeah, that's exactly what they'll do.
All right, quick thing. The Wall Street Journal reports on board the flight to Cleveland with the president, Bill Stepien, Congressman Jim Jordan, Ivanka, all there. If you're them today, do you go quickly get a test?
There's debate on that in the medical community. If it were me personally, I'd probably go get a test. My patients, I would say, hey, go get a test and maybe get a second one 24 hours later. That's probably the safest thing to do, but there is some debate on whether or not you should be tested if you're asymptomatic.
Congressman, Dr. Green, let me ask you this. You've been talking about how the president, he wants to get back as soon as possible. He's been compared to the Energizer Bunny before. So the news broke late last night that he had COVID, or actually early this morning that he had COVID. He stays up late at night. He gets up first thing in the morning. He's probably up right now. He's doing he wants to do things. But as somebody with potentially exposure to COVID and has contracted COVID, what should he be doing in addition to what Dr. Siegel said, taking zinc, taking vitamin D, things like that? Should he be getting a lot of rest? Should he just turn off the TV? Well, actually, bad idea. Maybe. I'm kidding about that. What should he be doing at home?
Obviously, it's just like any other viral illness. You want to stay hydrated. Of course, the zinc and the vitamin D have shown, folks who have a worse outcome are oftentimes vitamin D deficient. So, people should be on that and get tested for that from their primary care doctor. Rest is important, but no more so than he normally requires, which is for him apparently a lot less than most of us.
Just a couple hours.
Congressman, what do you say to those people who are already criticizing him?
For becoming positive with COVID, you know, I think that's just another opportunist. You know, the left, I've only been here for 18 months or so, a little over 18 months. I'm a freshman congressman, and they've done nothing but bully this president from the beginning. It's really quite despicable. And, you know, here's some of the things that they're now saying about Amy Coney Barrett is just, I mean, they're just bullies, and it's unfortunate.
Right. And Congressman, the other thing is, let's just look on the reality of politics. You got 30 plus days until we have an election, but there's a lot of other people on the ballot, Republicans on the ballot, that were concerned about their own future. From Senator Lindsey Graham, just got $10 million from the RNC in a fight of his life. Joni Ernst, Tom Tillis, what's happening with Martha McSally over in Arizona. They're on the bubble right now. What does this do for their chances, as Amy Coney Barrett is also somewhat of a risk, they say, for those in tough battleground states? What happens now that the president has to pull back and then other people look at, they're going to say, how is the president done with the virus? And they're going to look at that he has it now positive. What does it do for their political fortunes?
You know, honestly, I think it depends on the district that they're in. Again, I've been at this a little less than most, but what I have learned is that each district is very specific, and the president has an impact one way or the other on each district. So I really couldn't answer that question. I think some people, it will probably, you know, maybe have a negative effect.
All right. He's an ER physician. He's also a member of Congress for 18 months, as we just heard. Congressman Mark Green from the great state of Tennessee. Sir, thank you very much.